Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Hey everyone, welcome back to another episode of Boombostic Health. This is episode 39. I am your host, Bradley Bostic. Today we have a very interesting topic, which is all about how we can become better at detecting cancer earlier with no invasive procedure required whatsoever, just using urine. And Curtiss McNair, who's the VP of Operations at PanGIA, is going to talk to us about how this incredible new breakthrough can work and where they are in this journey to bring it to the world. And also, even bigger than that, Curtiss has become an expert in leadership development in healthcare. And I talk a lot about this. Healthcare is going to be as successful as the leaders who are there to drive it forward. So I'm really excited to talk to Curtiss about both of these topics. And also, Curtiss is an all-around cool guy. So always love to have the chance to talk. And next time, hopefully we can get you into Indianapolis. Maybe we can play a round of golf at Cricket Stick. I'm actually here in Indianapolis at our headquarters of our Health Cloud Capital portfolio companies. And I would love to know, Curtiss, where are you? And just give us a quick intro of your own on, your background.
Thanks, Bradley. First of all, it's always good to talk to you. We always have great conversations and have a good time together. I am located in Central Florida, actually live in Tampa, Florida. I'm actually from Rochester, New York, way up north in snow country. Came down to Florida about 10 years ago now and been here ever since, and not trying to go back. I don't want to go back to shoveling snow again. But had some excellent opportunities at some great companies right now at PanGIA Biotech down in Delray Beach, doing some phenomenal things with our CEO, Holly Magnachetti down there, and our Chief Strategy Officer, Rob Cardwell. So I'm just doing some fantastic things, looking forward to what we have coming and how we can help patients and also help healthcare leaders across the globe. And in my spare time, yes, I like to play golf. I like to play golf a lot. So I'm going to take you up on that invite to come up to Cricket Stick.
Sounds great. I think it'll be my second round of the season if you can make it up. So I am not playing as much as you are, but I do enjoy it. And mainly for just the camaraderie, I tend to not necessarily score all that well. Although, I'll have a par to start the round, for example, and then maybe the second hole, I end up maybe even with a birdie. And then it's usually around like the sixth or seventh hole where the wheels start coming off. So maybe you can kind of help me with my focus and my mindset on the golf game. So also I have to just point out, because I think it's really cool, behind me is this really awesome painting that you might notice. And it's actually a really large painting. If anybody who wants to come see us in Indianapolis sometime, I can give you a little tour and show this to you. But it's a good friend of mine, Eric Wallentine, painted this for our companies. And it's really meant to illustrate this fusion of old and new technologies. And this was way before AI had started to become a big mainstream thing. But these two cyborg looking robots are actually shooting binary code out of their fingers.
Wow.
You probably can't see it, but it's a really cool piece of artwork. And I want to thank Eric, my good friend, for creating that for us. It's been proudly displayed here in our office. So, I'll have some tangents here and there because, look, we don't get to catch up very often.
Very true.
And great to hear that you've got your golf game going. And in parallel, you're looking to conquer this problem of far too often people are not diagnosed when they could be early on in their cancer journey. And this oftentimes, if you want to get an earlier screening, like my mom died of colon cancer. So everyone who's close to me, I always encourage them to get colonoscopies, which takes a little bit of prep. I still highly recommend doing that.
Absolutely.
Recently had an experience where someone who's very close to me had a polyp removed. And who knows, down the road, that could have turned into a serious issue and could become cancer. So we need more ways to get more proactive and more preventative and ways that are accessible as well to everyone, because not necessarily everyone has access to a surgeon to do a colonoscopy, or they might not be they might not even have the transportation to get there. So with this kind of a urine test that you're developing and that has actually proven to be effective, how does this transform the way that cancer could ultimately be managed in the future? And gosh, I don't know, maybe does it even help us get to where other cancers are curable. I don't know. Help me understand a little bit more how big this could be.
Absolutely. You teed that up perfectly. So here's what I'm going to say. I'll characterize it and frame it this way. When you and I were little, I think we're about the same age. We dreamed of a day, or we dreamt of a day where we could, I wonder if it's possible to turn the channel on the television without having to actually get up and turn the knob. Or I
Right.
wonder if there's a way to warm up our food without having to put it in the oven and wait 45 minutes, microwaves. Or I wonder if there's a way we can dial on the telephone without having to dial that big rotary dial and those types of things. So that's kind of where we are with cancer detection, to where we ask ourselves the question at PanGIA: is there a way to detect cancer early stage and it not be an invasive, painful, limited access procedure where the haves can get those procedures and the have-nots typically get diagnosed late and die? And so those are the questions that we asked ourselves, and ultimately came up with a method and a test and a platform to where we've proven that we can do just that, to where we can take a very non-invasive biospecimen like urine, everybody does that every day, and test it using a very complex AI algorithm and training neural network model, and detect different cancers at the same time, early stage in urine. What does that do? It helps access, number one. Patients who are afraid to have biopsies no longer have to be afraid of that. That's number two. And number three, it opens the door wide open for what this might mean for preventive care down the road, once we can see different nuances and similarities between different cancers, cancer types and stages. And so we're very excited about what we're doing.
And this is not just an idea that's on the drawing board. This is real. Being there's evidence based studies that are underway. I know you recently had some recognition at ASCO 2025, which is the epicenter for cancer-oriented diagnostics and treatments. Talk a little bit about the evidence and just how the numbers are coming back that can give us confidence that this is actually as promising as it sounds.
Sure, sure. We released our first study and paper. And it was actually published, as you said, in the Journal of Clinical Oncology with an ASCO abstract supplement this year. We got a lot of attention and a lot of eyes on what we're doing, specifically because the results from our initial study was specifically, we are achieving or proved a greater than 96% sensitivity or a recall. What that means is we're not missing any cancers when we're testing with our method. Number two, our results also showed just over a 74% positive predictor value, which is precision. So what that translates to, Bradley, is physicians and patients can trust the results. They can trust what they're seeing in terms of what our platform is telling them. And a third one, which is really, really key, a greater than 84% F1 score, which means there's a balanced accuracy across sensitivity and precision. So not only that information and statistics there, a paper and results were peer reviewed in the Analyst, which is Royal Society of Chemistry, which underscores credible science out there in the world. And we are paving the way. Those results and studies paved the way and approved our institutional review board and ethics committees for a new study that we're getting ready to do that's going to show 10 different cancers at the same time. So the results are there. The accuracy is there. The technology in terms of our methodology is solid. We're proving more and more every day. And when we come out with our next study, we're going to continue to show that, hey, listen, we're not just looking at prostate cancer, which has already been released and in use in areas like India, which is very significant, but we're also a multi-cancer platform where we can detect all these different cancers at the same time with high accuracy.
So, what's the journey like from here to where all of our viewers could potentially benefit, their loved ones could benefit from this kind of a test?
So the journey is, right now, our path is releasing overseas. As you well know, when you're in the healthcare industry, dealing with the FDA can be a little bit difficult sometimes, but not that for us. For us, it was a prime market in India for us to release our initial prostate cancer assay. Reason being is because of the cultural sensitivity in that region with regards to prostate exams. as a man, you understand, or if you've had loved ones who've had prostate exams, it is a very invasive, very painful, very messy procedure. And in certain regions, with regards to religious background, prostate exams just don't happen. And so those regions typically see a lot of healthcare disparity when it comes to tests that require a prostate exam, like prostate cancer. And so India was a prime market for us to launch in. We did that successfully. We're continuing to expand in India. And what that means for folks watching your show is as we continue to develop and release our second study, that will pave the way for greater access for those who need the test.
So India is the first market that's benefiting from this, and that's being studied. Do they run a process in India similar to what would happen here, where it's a study, and there are certain
Absolutely.
physicians that are
Absolutely. So,
involved?
yeah,
Okay.
absolutely. So the study is completed. So we actually have partnered with a company, oncology group called Oncoceutics, Canary Oncoceutics. They are an oncology group that have partnered with us to release this assay and platform across their region with more and more interest every week. So we're on the phone with them weekly, looking for ways to expand. Actually, our door is being knocked on and our phone is being called because of what we're doing. So it's just a phenomenal opportunity for folks in that region to get their hands on a test that will ultimately save lives in the community.
And so artificial intelligence is key to enabling this new kind of approach to chemistry and analyzing urine. Can you speak to that? How is AI making this possible?
So actually, when it comes to AI, a lot of listeners and being at different conferences are really intimidated by the term artificial intelligence because we watch a lot of movies like The Terminator and things of that nature where Skynet went live or became self-aware. Or if not that extreme, a lot of folks are kind of intimidated that AI will take their jobs. Well, here's the bottom line. We use AI in every day of our lives. When you're texting on your phone and it does that word help to where it finishes the word for you, where you can just select the word. Well, that's AI and other things that we're doing, or Alexa or Siri or Hey Google, those types of things. AI is important because it can see and detect things beyond our human current capability. AI can also perform mathematical analysis beyond what we can perform, like tapping into how a neural network works in a human brain and the millions and millions of synapses that are happening at the same time while we speak and talk and do different things. Well, we've been able to develop an AI method to where we can do just that. We've developed a code and are continuing to develop that code to where it can look at the small nuances between different cancers at different stages, different specimen types, specifically urine for us. And it can also look at similarities between same cancers and different cancers at the same time. And therefore, basically learning or training or teaching the model as to this is what, for example, a prostate cancer positive patient looks like at stage 4, at stage 3, at stage 1, at stage 2, or here's what a positive breast cancer patient looks like, and here's what a negative looks like. Here's what a BPH patient looks like, or a benign prostate. And so we've been able to develop and train that model to help us detect what we're seeing, but most importantly as well is what we're not seeing.
Right. Interesting. That's so cool. Well, oftentimes people don't really appreciate that, as you said, AI is part of everything that we do already. It's already built into these services that you have on your smartphone, for example, and have been for a long time. Also, services like Grammarly, which is awesome, and Duolingo to learn languages.
Absolutely.
Like these are already using AI in ways that are very powerful. And I think what people worry about in healthcare that I hear from is this idea that the AI will try to independently make some kind of a decision or have no physician interpretation and potentially miss things, or like the HAL 9000, 2001 Space Odyssey is what I thought you were going to mention, which it was the most palpable, I'd say, prescient example of where things could potentially go wrong. And in healthcare, where you're talking about life or death, it's not something where you want to have some rogue machine making decisions. So if I'm hearing you correctly, this is a tool that will help enable clinicians to have another indicator in addition to other indicators. It doesn't eliminate having biopsies or eliminate other diagnostic pathways. It just adds a screening mechanism which reminds me of the Cologuard, which is where you order the kit and you use that kit to do a collection of fecal specimen. And that goes into a lab that then uses the test to identify potential indicators of colon cancer.
Absolutely.
And that's been a very successful direct to consumer type of a service, a diagnostic. It took a lot of years before it was acceptable to be reimbursing for that, which is kind of a head scratcher in hindsight, but it did. Do you think of this test from PanGIA and this new modality of using urine as somewhat like that, where people could order the test, be able to do the urine test, and then see, hey, do I have an indicator that would tell me I should go have more detailed diagnostic testing? Is that what would happen?
That is perfect, actually. So we looked at Cologuard, and the closest comparison to what we do is that test, to where we put the power back in the hands of the patient, not just with a test that they can perform at home and not have to schedule a doctor's appointment 3 weeks, 4 months out of the way, but they can do it at their leisure. It's a non-invasive sample, but also we put the decision-making back in their hands to where they're at the helm, if you will, of their patient care and or recovery or maintenance for that matter. Also, here's the deal, mentioning AI, going back to that a bit. I worked with a company called HC1. I think you might know who they are, with a predictive analytics or a workforce optimization tool using AI. AI doesn't take the decision out of your hands. It gives you more information to work with so you can make an informed decision, but ultimately the decision is yours. So think about it. When we think about healthcare and we look at the latest literature with biopsies and healthcare access, the latest literature states that 66% of prostate and brain cancers in terms of biopsies come back benign. That means that, what, 2 out of every 3 brain cancers or prostate cancer biopsies come back negative for that cancer.
That's an invasive. If you think about the brain, for example, to do a
Absolutely.
biopsy, to be clear, you're taking a piece of tissue out of somebody's brain, and you're
Absolutely.
saying that that particular tissue ends up, thankfully for the patient, being benign. But unfortunately, to get to that conclusion, it took an invasive step to put a hole in somebody's head.
Correct.
And you're saying with this test, potentially it could get to where that would be unnecessary
That
because
would
you could.
that would be unnecessary in some cases, and in breast cancer, up almost 80% for a lot of different reasons, but come back benign. So, so our test would not necessarily eliminate biopsies, but would add a preliminary step to see if you need a biopsy or not. For example, if the physician or your doctor suspects cancer of any type, instead of jumping the gun, going direct to biopsy and having coming back negative, our test would come in first. If our test comes back results consistent with someone who has this particular cancer, then yes, the biopsy would be needed. If it comes back results not consistent, then a biopsy would not be needed. That's what we've studied, and that's where we are.
Well, the concept is awesome, and I would bet on you. And I also would love to see this be an absolutely blockbuster success as an enterprise, because if there's no margin, there's no mission. And it sounds like you're onto something that could have a profound impact on people's lives. So thanks for investing your effort into that for the good of all of us. And as I mentioned, my mom had colon cancer and she had never had a colonoscopy. And by the time she finally had one, it was stage 4. It was already metastasized into a lot of different sites. And she really statistically had no chance to survive. And she passed away. It was about 11 months after she was diagnosed. And up to that point, she seemed quite healthy. So how somebody who went to get a physical every year and took good care of herself and had all the resources to be healthy, she actually was a great golfer. She played a lot of golf. How she could end up in that situation, it's unfortunate, obviously, to put it lightly. And with this kind of a diagnostic, maybe in the future, that type of situation could be prevented for somebody else's mother. I certainly hope that it is. So
Absolutely.
switching gears to this bigger leadership item that I know you're passionate about, and I am as well. We spend a lot of time as healthcare innovators and investors and just consumers trying to figure out how we can make healthcare better. Why are there so many issues in healthcare? And there are a lot of reasons for any issue in the world. But when it comes down to a complex ecosystem of businesses, it really ultimately is about leadership. And it seems like we don't have enough of those amazing leaders in healthcare to take us down this path of getting to more of a preventive, value based world that ultimately has the right incentive. So people know conceptually, theoretically, we shouldn't be in this volume of sickness drives economic success. It should be volume of health,
Correct. Correct. Absolutely right.
drives economic success. And I would love to hear from you. What do you see as these key tenets related to building this machinery that drives more and more talent and creates more prosperity for healthcare overall?
I think that that's a great topic. I think that, and I'm very passionate about this. I think that organizations and companies, healthcare systems, and primarily leaders have to become more vested and invested when it comes to perpetuating healthcare through leaders that are already there. The problem has been that previous leaders and organizations have not passed the baton appropriately, if they've passed it at all, with regards to succession planning, leadership development, and character development. And this is the thing that we are missing now. There is what I'm going to say, a great gulf that seems to be fixed, or a great gap between our current leaders and where they need to be in terms of their leadership prowess and ability. And I think that we need to put a little bit more effort into growing leaders, developing leaders, having training tracks and leadership tracks, because it's going to affect the bottom line. Actually, it's already affecting not only the bottom line, but it's affecting healthcare outcomes with our patients and our communities, because we just don't have that experience. That knowledge has not been passed over. And in an age of automation and AI, it's not about leading tasks anymore. It's about leading people to lead those tasks. And so we really need to put more emphasis on that right now.
Right. Yeah. Well, that certainly resonates with me. And it reminds me of a conversation I recently had with a retired nurse who had gone into leadership in her career. And she had gone from being a nurse to managing a team of nurses to ultimately running the transplant center, and then also being over all of the infection control of this health system, good size health system. And it was funny. I was talking to her about this very issue of leadership development and how ultimately I aim to make a big impact on developing more leaders for healthcare for the reasons you're mentioning. And she said, it's funny you say that because I certainly had no leadership training. She said, in fact, when they tapped her to go from being a nurse to managing people, she was like, I don't really know how to do that. And then she just did it, figured it out. And then ultimately running the transplants and then infection prevention, it was just a huge leap for her. And she's a really high quality person who did well and had a great career and ultimately retired in that profession. But she just lit up when I started talking about what if there were some kind of a leadership development program, some type of an academy that people who are already maybe getting their master's in value-based care, public health, or they're looking to go into administrative roles with a background in something clinical, but they don't necessarily know exactly how to be a great leader. What if there was a program to help people actually specifically for healthcare leadership get to where they can perform at the top of their game? And she thought that was a fantastic idea. Is that something that you've thought about?
Absolutely. I mean, I came from an era where we studied Dale Carnegie and we did Toastmasters, and basically leadership development is not as complex as some people might think. There's a program called Each One Teach One. Basically, it's a mentorship program. So it's all about having effective communication and relationships with other people, or being able to create a bond and a connection with the person working next to you, above you, or beneath you. And so I put it to you like this: the great John Maxwell, great leadership guru, I revere him very much. He said this: he said, if you're a leader and nobody's following you, you're simply taking a walk. You're not leading.
I love that. I've never heard that.
Yeah. So the responsibility of leaders is to really create and forge relationships and have people follow us, and basically create another entity outside of ourselves that can take the task or the mission beyond where we took it. And so ultimately, your primary responsibility is to find another person who has that same prowess, who has those gifts and talents, and pour into them what you have so they can take what you have to the next level.
Yeah, no, I agree with that. And also, there are systems that you can follow, regardless of the business that you're in or the area of healthcare that you're in, to help lead, manage, and hold people accountable and
Absolutely.
create clarity on what there's expected of them and to work through initiatives that can make process better and patient experience better, outcomes better. So, a lot of these fundamental concepts of leadership that are applied to, say, e commerce, for example, with Amazon, applying those leadership concepts into the healthcare environment, I think can allow us to unlock a lot of value moving forward. Well, I think we could talk probably for another hour at least about these critical areas of healthcare. But I want to just thank you, Curtiss, for first of all, just being a great friend and somebody who I've done business with. You mentioned the HC1 example where I'm CEO, and we've had a lot of success innovating together already. I suspect there'll be more in the future. And I
Absolutely.
love the fact that not only are we talking about these concepts, we're actually doing it, which is probably the biggest thing that distinguishes the Boombostic health community and this podcast from a lot of the others is lots of people pontificate and theorize. We actually step into the arena and, figure out how to fight and win, if I can use that metaphor. And and that's a different breed. And I think we need more people doing that. And I appreciate the great work that you're doing. And the invitation is open to come play golf anytime up here at Crooked Stick. And, or maybe I'll find my way down to Florida in the winter sometime, which is a little bit nicer for golf that time of year.
Absolutely. Thank you for all you've done. And our friendship has been great over the past few years. Thank you to your wonderful platform and your listeners and your watchers on Boombostic Health. I'm sure a lot of great things are coming out of it. I see a lot of the episodes, and so you're doing a great thing. So thank you for this work that you're doing. Thank you for this opportunity, and looking forward to many, many great things.
I appreciate the kind words and keep making it happen at PanGIA. Thanks so much for being here. And thank you to everybody in the Boombostic Health community. This was episode 39 with my good friend, Curtiss McNair, who is leading operations for this promising new diagnostic at PanGIA that maybe someday can help us actually eliminate preventable cancers from the population. Wouldn't that be great? I'll look forward to seeing you all next week. Have a Boombostic day.